Hello guys, welcome to my channel. In today's video we are going to talk about a very interesting topic, which is snake bite. We'll discuss that what are the measures that you have to do at the site of snake bite, are the measures you have to do in the management at home. We'll also discuss about what are the do's and don'ts in snake bite, the commonly found snakes, and the management accordingly. So first of all, if a patient gets bitten by a snake, the first and foremost priority is that you have to reassure the patient. Reason why is that these patients, as soon as the snake bites them, they get worried and they are so much anxious, in that there is sympathetic overactivation and increased heart rate. This is the common cause of mortality in this patient. So you'll find that even in dry bites, what you see is that patients would die because of anxiety related with, and so it is a must and it is very important to reassure the patient that not all snakes are poisonous and not all bites are venomous. And then you have to clean the wound with simple water. After that, immobilizing the patient is also very important. Immobilizing the limb while the patient is being transported from the site of bite to the hospital is where people do the common mistake, and understanding it is very important. So for immobilizing the limb, what you need is that you need two things. You need a splint like this and you need a bandage like this. And then what you need to do is that you need to place the rope or the wood underneath the limb that has been bitten by a snake, and you take the bandage and wrap the bandage around the leg. You wrap the bandage around the leg like this. Then what you need to do is that you need to press the rope or the wood underneath the limb that has been bitten by the snake, and you take the bandage and wrap the bandage around the leg. You wrap the bandage around the leg like this. So the purpose of splint and the bandage is to immobilize the leg. And there is another purpose to this bandage. So the second purpose of the bandage is that it should be tight enough to occlude the superficial lymphatic present in the skin. It should not be very tight that it occludes the blood supply, it occludes the arterial supply. Occluding the arterial supply will do more damage. It will do more damage than the benefit. It will do more harm than the benefit. So the aim of this bandage is to block the superficial lymphatic, and it should not be very tight. So let's talk about the old traditional method. So we find that in the old traditional method, as I said, that at the point of immobilizing the limb, people do the common mistakes. The old traditional method, they do more harms than benefits. The old traditional method includes tightening a tourniquet. The old traditional method of tightening a tourniquet on a limb which has been bitten by a snake, it is very harmful. Why is it harmful? Basically, when you tighten a tourniquet on the arm or the limb which has been bitten by a snake, the arterial supply, the venous supply is cut off, and the patient starts to develop swelling in that limb. When the patient starts to develop swelling in that limb, and when the patient comes to the hospital and you open a tourniquet, there is gush of poison and venom into the circulation, and the gush of venom into the circulation causes death of this patient. So this tourniquet is a very harmful technique. So that's why we place a bandage which is not tight enough to occlude the arterial blood supply, but is just tight enough to occlude the superficial lymphatic. So other odd techniques include cutting the wound to take the poison out, squeezing the wound, sucking the poison out of the wound by mouth. These are old traditional techniques, and they cause delay of shift of the patient from the site of bite to the hospital. The common presentation will be that patient will come to you in the hospital and they have been bitten by a snake and they have placed a tourniquet, and now you have to manage that case. Now, if a patient has a tourniquet placed or tighten around the limb, now you cannot directly open the tourniquet because it will cause the gush of poison into the whole body. So what you need to do is that you have to take a blood pressure cuff and tighten it around the arm before the tourniquet or behind the tourniquet, and you have to inflate the blood pressure cuff up to the systolic blood pressure, and you keep it inflated, and then you open the tourniquet and you slowly gradually deflate the blood pressure cuff. So deflating of blood pressure cuff slowly and gradually will cause the entry of poison slowly into the body so that the body can cope with it. Inflating the blood pressure cuff and deflating it over a long period of time will cause poison to gush slowly into the body, like I'm saying. So cleaning and immobilizing the wound, that's what you do when the patient is outside the hospital. When the patient has been shifted to the hospital, you approach the patient with ABC approach. You take the vitals, you check the blood pressure, you check the pulse, you check the temperature of the patient, and an important vital that you have to take along with these vitals that I've mentioned is a single breath count. What is a single breath count? A single breath count tells us about the respiratory reserve. Many patients are bitten by snakes that have neurotoxins in them. These neurotoxins can cause respiratory paralysis. Respiratory paralysis will cause decreased respiratory reserve, and this patient will need a ventilator. So to assess that a patient is having respiratory paralysis or not, you need to ask a patient to take a single breath and count up to 30. So what the patients do is that they take a single breath and they count up to 30, like, and then they start counting 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26, and they just go up to 30. A normal person can count up to 30 in a single breath. If a patient is now counting up to 20, it means that he is progressing towards respiratory paralysis. If a patient can now count up to 15 in a single breath, it means their respiratory reserve are going down, and these patients will need a ventilator. After that, you have to take a breath history from the patient. Commonly found snakes in regions like India and Bangladesh are neurotoxic snakes and hemotoxic snakes. So neurotoxic snakes include cobra, kraits, and hemotoxic snakes include Russell's viper, saw-scaled viper, pit viper. So neurotoxic snakes like cobra, this is a common snake in Indian region. Other than that, krait, it has white lines over it, and so this neurotoxic snake can cause severe pain and paralysis of the body. Patients will be having paralysis of the body, weakness of the body. These snakes, they bite their predators and they paralyze them to death. The first signs you see in this patient is the eye signs. In these patients, you'll be seeing ptosis and diplopia or hemiplegia. So these are the first signs that you need to observe. After that, the most life-threatening and feared effect that should be in your mind is that these patients will now progress to respiratory failure, and you have to save them before they progress to respiratory paralysis. And this is an indication that you have to give the patient snake venom. Coming to hemotoxic snakes, which include Russell's viper and saw-scaled viper. These snakes, they make their prey bleed to death. They cause hemorrhage, they cause bleeding, they cause coagulopathy, and the first sign you will see in these patients is that if you see this patient, they will be bleeding from the fang marks. And when you pass the IV line in this patient will be bleeding from that IV line point, or this patient might develop conjunctival hemorrhages or hematuria. So these are the classical things that you should look at. And the late signs will be that this patient might start bleeding from gums, blood in stools, and bleeding from the nose, bleeding from all pores of the body. So these are hemotoxic snakes. Now remember that Russell's viper is rhinotoxic. It causes renal failure within a short period of time, few hours. Remember R for Russell's and R for renal failure. These patients will have oliguria, hyperkalemia, and they might be dialysis, otherwise they will die of the poison. After you have shifted the patient to the hospital, you have taken the vitals, you have taken the single breath count, and you have taken the history, you have known the type of snake. Now, after understanding the mechanism of action by which these snakes kill their prey, now you can easily understand what investigation you need to order. You need to order bleeding profile, CBC, fibrinogen levels, fibrinogen degradation product in order to see coagulopathies in hemotoxic snakes. you need to do RFTs for Russell's Viper, you need to do CPK levels, you need to do LFTs. So these investigations now make sense to you because you understand the way these snakes can kill the patient. Now some of you might ask, excuse me sir, what if you're in a peripheral rural area where you do not have facility of doing bleeding profile? What can you do? So what you can do is that you can take a clear bottle, a clear transparent clean bottle like this, and put 3 to 5 cc of blood in it, and then place it undisturbed for 20 minutes. After 20 minutes, if the blood gets clotted, it means coagulation profile is normal. But if the blood is still fluid after 20 minutes, it means that the patient has been bitten by a hemotoxic snake. So this is a simple method of which you can check the bleeding profile of the patient. You take the labs and then you do local examination. So for local examination, you check the fang marks. Throbbing and burning sensation at the bite site is very common. If you see the classical fang marks, what do I mean by classical fang marks? Classical fang marks are 2 bite marks, more like 2 teeth that have bite the patient. This is a classical fang mark, and most likely these snakes which leaves classical fang marks are venomous snake. Now we will discuss that what is the difference between a fang mark of a venomous snake and a bite of a non-venomous snake. You can even spot that whether a patient has been bitten by a venomous snake or a non-venomous snake by the marks which they leave. If the patient has been bitten by a venomous snake, it will leave a classical 2 points fang mark, and maybe you might be able to find a single row of teeth behind it, and you may not be able to find a single row of teeth behind it. Most often you will not find the single row of teeth, but you will see the classical 2 fang marks. In a patient with non-venomous snake bites, there will be 2 rows of teeth. The 2 rows of teeth shows that the patient has been bitten by a non-venomous snake, and most often what you will see is that there will be presence of scratch. So a scratch usually shows that the patient did not get a proper bite, it was a non-venomous snake. Remember, snakes like kraits leave no fang marks most of the times. Reason why kraits have very, very thin fangs, and those thin fangs do not even leave a bite mark. Check also for erythemas, swellings and blisters. Swelling is a very dangerous thing. If a patient had swelling in half of his limb, now the whole limb is swollen, it means that the patient has been bitten by a venomous snake and he is going to die if you don't give him anti-venomous snake. After performing local examination, now you have to perform systemic examination. Under systemic examination, you look for bleeding from wounds or mouth. You look for lymphadenopathy. Lymphadenopathy is also important. If the patient has been bitten on the hand, you check for axillary lymphadenopathy, you check for cervical lymphadenopathy, and if the patient has been bitten on the leg, look for inguinal lymphadenopathy. Look for signs of respiratory failure. Look for limb swelling, and if the patient is having a severe limb swelling, you might even consider going for fasciotomy because this patient can develop compartment syndrome. If a patient is in shock, you have to treat the shock by giving fluids. You can put the patient on support as well, and then you have to make a decision of anti-snake venom administration. So give anti-venomous snake venom if a patient has classical fang marks, if a patient has fast spreading local swellings, if a patient has tender lymph nodes, if a patient has coagulopathy, if a patient has neurotoxic signs like ptosis and ophthalmoplegia, if a patient has impending respiratory failure, if a patient has got hypotension, shock, arrhythmias, if a patient has got hypokalemia, if the patient has rhabdomyolysis, which is muscle breakdown with elevated CPK. These are all the indication that the patient deserves to get polyvalent anti-snake venom. This is a commonly found polyvalent anti-snake venom, and it is effective against 4 types of snake, which include cobras, kraits, saw-scaled vipers, and Russell's viper. Now let's talk about how to administer polyvalent anti-snake venom. Remember that these anti-snake venoms are prepared in other animals like horses, so there is a tendency that they may cause an allergic reaction in a patient or anaphylactic shock. So how do you administer polyvalent anti-snake venom? What you do is that you have to take 50 ml of anti-snake venom and you dilute it in 500 to 1000 ml of either normal saline, dextrose saline, or dextrose water, and you slowly start the IV infusion. You can give antihistamines before giving snake venom for preventive measures of anaphylactic shock. You must have antihistamines, adrenaline, and hydrocortisone at hand when you are giving snake venom. You should not start infusion if you do not have any of these things. If a patient develops anaphylactic reaction, what you need to do is that you should stop antivenom infusion. Then you have to give antihistamines and then administer adrenaline, hydrocortisone, and then you wait for some times. If the patient gets better, you slowly restart the infusion. Antivenom dose can be repeated if the symptoms persist. And when a patient has been bitten, every patient must receive tetanus prophylaxis and the prophylactic antibiotic. So patient must be kept in the hospital for the next 24 hours. So if the patient has been bitten by a neurotoxic snake and is developing signs and symptoms of neurotoxin, you must give atropine and neostigmine to the patient, and you must have a facility of mechanical ventilation. And if the patient has been bitten by a hemotoxic snake and the patient's blood is getting depleted, what you need to do is that you have to give appropriate blood product.